today we're going to be doing the Ospe of the leg. You can see your leg is lying from your knee joint to the ankle joint. This is the area of the leg. Leg is divided into 3 compartments: the anterior, lateral and posterior compartment. Let's talk about the anterior compartment first. The main nerve of the anterior compartment is the deep peroneal nerve, and the main artery is the anterior tibial artery. So let's go ahead and find these structures. The first thing you'll see when you open the anterior compartment of the leg are the muscles, alright? The muscles of the anterior compartment of the leg are mostly extensors, because anterior compartment extensor, posterior is flexor, which is completely on the contrary to the upper leg, alright? So the first thing you see, medial most muscle is going to be the tibialis anterior. Then you're going to see the extensor hallucis longus. You can see the tendon of extensor hallucis longus right over here. Then we have, going a little laterally, this entire muscle over here is the extensor digitorum longus. You can see that this is splitting into 4 tendons. The next muscle of the anterior compartment comes the peroneus tertius. You can see it right here, this area right here. Now, when we take off the muscle, the deeper structures are where the neurovascular bundle of the anterior compartment is lying. These are this is yellow color is the deep peroneal nerve, and the red is the anterior tibial artery. And you can even see the interosseous membrane between the tibia and fibula over here. Just want to show you that there is no medial compartment of the leg, as it is subcutaneous, because this bone can be felt very close to your skin. It's superficial, alright? This is the medial surface of the tibia. Okay, let's go to the lateral compartment. Only 2 muscles, and the main nerve is the superficial peroneal nerve, whereas the artery is the peroneal artery. So you can see here, this is the peroneus longus, and lying just deep to it, this is the peroneus brevis. So these 2 muscles are lying the lateral compartment, and these are all everters of the leg. Okay, let's go to the posterior compartment of the leg. The posterior compartment is further divided into 2 parts. There is the superficial muscle layer and then the deep muscle layer. Now the superficial muscle layers are very important. They are the calf pumps. They are basically going to pump your venous blood to the heart. So here you can see the 2 heads of the gastrocnemius. There's the gastrocnemius, there's the medial head, and there's the lateral head. To detect the medial and lateral, you can always always refer to the toes. The medial toe, the great toe is always the medial side, and the little toe is the lateral side. So I know this is the medial head, this is the lateral head of the gastrocnemius. When I remove the gastrocnemius, lying deep to it is our soleus muscle. The soleus is known as the peripheral heart. The soleus muscle, and just lying superficial to that, this tiny tendon over here used for grafting, this is the plantaris tendon. Alright, so it's lying between the 2 gastrosoleus muscles. And now the insertion point of the 2 gastrosoleus muscle, this is going to be on the back of calcaneum via this important tendon, which is very strong, known as the tendoachilles or tendocalcaneus. Alright, let's move to the deeper muscles. Here I want you to know that the posterior compartment's main artery is posterior tibial artery, and the main nerve is a tibial nerve. So the first thing I can see are these 2 neurovascular bundle. The red is the posterior tibial artery, and the yellow is obviously the tibial nerve. It is continuing straight from the sciatic nerve, whereas you can see over here this is the common peroneal nerve, and it's going to divide into the superficial and deep. Deep for the anterior compartment, superficial for the lateral compartment, whereas tibial nerve continues direct downwards and supplies your posterior compartment. So the first muscle we can see begins here and ends here. So this muscle ends very soon. This is the popliteus muscle. This muscle, which is the deepest of all muscles, is the tibialis posterior. Now we have 2 flexors. We have a digitorum and we have a hallucis. All you have to do is, on the lateral side, looking at the little toe, you have to put the flexor hallucis longus. On the medial side, you'll be viewing the flexor digitorum longus. And there you have it. These are the deep muscles of posterior compartment of the leg. The other things we can see here in the posterior to the knee joint are the genicular branches for the anastomosis of the knee joint. This is the inferior lateral genicular, the inferior medial genicular. And superiorly, in the thigh, you can see the superior medial and superior lateral genicular. Alright? And these are the popliteal artery, tibial nerve, popliteal vein. You can see right here, the common peroneal nerve is splitting into its 2 terminal branches. One is superficial peroneal for the lateral compartment, and one is deep peroneal for the anterior compartment. So the superficial peroneal nerve, after it supplies the lateral compartment muscles, it itself comes superficially, and once it comes superficially, it is going to supply most of the dorsum of the foot. Whereas the deep peroneal runs deep, and finally you can see it come out over here at the first interdigital cleft, where it will give cutaneous supply to the first interdigital cleft. And this right here, this nerve over here, is the sural nerve, which is going to supply lateral side of the foot. So that was all you needed to know for your leg. I really hope you understood well. Thank you so much for watching.